Hi, this is Brian Kim. I'm going to share with you case number 148 in the Best Way to Do Cataract Surgery series. This is a soft lens with a giant pupil, and I'm going to show you hydrodelineation and how the golden ring sign can help you in placement of the chopper for double chop and cross chop. But more importantly, this is the easiest, most efficient way to disassemble a soft lens. I see a lot of people struggling removing soft lenses, and that's because they go after it with high vacuum and the lens just crumbles and it doesn't pull the lens piece up out of the bag. This to me is the most efficient and most common sense way to disassemble a soft lens, and you'll see that here in this case. So again, you can see how big this pupil is. I'm using cotton tip to steady the eye, and then this is a corneal marker which will help me to center incisor-rhexis. I'm holding the eye steady, and I'm making my paracentesis incision first on the right side and then the left side, making sure I'm parallel to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine and some intracameral epinephrine, and then some dispersive viscoelastic to flatten the anterior capsule and coat the corneal endothelium. I'm using the cannula to control the eye, and this is a triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel, and then I enter. I'm using the cannula to hold the eye and control it when I do this. Pushing some more viscoelastic in, and these are the blunt tip Hydrodissection forceps. Again, this is an older case, but now I use a sharp tip forceps. I puncture. You can see there was a little bit of capsule stria there, but not too bad. I puncture, pull down, grab the right side of the tear, going around circumferentially, grabbing and re-grabbing. Again, this is a very large pupil, and that's why the corneal mark is really quite helpful, because I'm able to judge the actual size of the rhexis much more accurately based upon the corneal ring rather than the pupil. You can see with the Hydrodissection forceps, I have tremendous control and limited OVD egress because of the design. Burp some viscoelastic out, and this is the capsulorhexis hydrodissection technique. I place a cannula under the rhexis edge, contra-incisionally, pointed tip down, get a nice wave, decompress on the left side, and then this is my attempt to get the golden ring, which I do, and then I start to spin the lens on the right side. So the golden ring is going to be basically your landmark to where you can place the chopper. And so again, you don't have to go all the way to the capsule equator, right up to the capsule if you're really nervous. Removing the surface epinuclear material, and now we're going to go in slow motion again here. You see my hand is pronated on my left hand, the chopper is flat, pointed out to the periphery. I've removed the central epinuclear material. I place the chopper on the surface of the lens, sliding it under the epinuclear ridge, underneath the rhexis edge. By doing it this way, I'm 100% confident I'm within the bag and I'm not outside of the bag. You need to make sure you're down. And as I get to the golden ring, because that's the epinuclear and endonuclear interface, I'm rotating my wrist. So now the chopper is straight up and down. You can see the tip is pointed more down. But it's not just pointed down, it's pointed a little bit towards me. I rotate the phaco tip vertically subincisionally, and again, it's right about where that epinuclear ridge is, where I remove the central epinucleus. And because this is a soft lens, I'm able to apply horizontal vector forces. I'm able to embed the phaco tip so it's at the same horizontal level as a chopper. I bring both instruments together towards the center, and it basically cheese wires the lens completely in half. This is so efficient, so easy. There's no ultrasonic energy. There's no vacuum. This is just done with irrigation only. I'm able to fracture the lens without any difficulty. Really, this is kind of like doing pre-chop or MyLoop. It's basically using the same principles of mechanical cutting and crushing techniques to basically bisect the lens. But you don't have to use a special instrument or device to do that. And that's what I've been trying to teach all this time, is you can apply the same principles without having to use those devices. So I go, again, I turn the chopper sideways, go underneath the epinuclear ridge on the right side. I turn the chopper straight up and down again. Again, I placed the tip of the chopper within the epinuclear endonuclear interface, which is the golden ring. I pull the chopper centrally toward the phaco tip, which is now embedded between the lens pieces, and then the lens fractures. So now I have, very quickly, within a few seconds, 3 fragments. I'm using now high vacuum to grasp that first quadrant, and you can see the chopper is still within the capsular equator there, because again, I'm very comfortable and confident having my chopper there, and I know that I'm not going to cause any problems. And that's primarily because I know where I am. I know that I'm in the epi and endonuclear interface with the chopper. I'm not near the capsule, and the eye is inflated. And so if the eye is inflated, that means the posterior capsule, the entire capsular bag is inflated and away from my instruments. So I crush that first quadrant in half, and then using high vacuum to help emulsify the lens piece, and I'll continue to mash the lens piece between the instruments and emulsify the lens pieces. So again, soft lenses, this is really the easiest way. It makes no sense to try to sculpt a soft lens. The lens will just fall apart, and then when you try to crack the soft lens, it just crumbles. And then using high vacuum to impale the lens for vertical chop and horizontal chop makes absolutely no sense. You can't vertical chop a soft lens like this. I mean, you can, but most of those choppers have sharp tips. It really doesn't make sense to do it that way. You saw that I just placed the instruments around the lens and I sandwiched it and crushed it. To me, it makes the most intuitive sense. Again, the biggest hurdle that people have is placing that chopper out to the equator. Again, it's not that dangerous. It's very safe. And as you see here with the golden ring, that's a very clear demarcation line of where I'm placing the chopper. You don't have to place it all the way to the capsular fornix against the capsular bag. You can just place it right between the epi and endonuclear interface. You can see here I'm sliding the chopper underneath the second quadrant right there, getting underneath the rhexis edge, rotating my hand. So now the chopper is pointed straight up and down, getting underneath the lens with the phaco tip now. Again, these lenses are soft, so you can position your instruments very easily around the endonucleus. I pull the chopper centrally toward the phaco tip, and then again, of course, because it's soft, it just fractures that second quadrant in half very easily. Again, with more like a cheese wire effect rather than a crushing effect. When you have a very dense lens, it is a tremendous crushing effect because you see the whitening of the lens fibers and then sudden loss of resistance when you fracture the lens, again, with crushing forces of the dense lens. But in contrast, this is a soft lens. It's not really crushing it. It's more like a cheese wire because the instruments itself are purely acting as a wire. And because the lens material is so soft, you just have to have that cheese wire effect cutting through the lens material because it's so soft. And that is all you need to create some level of disassembly of the lens pieces in order to be able to take the pieces out. So again, when people are trying to disassemble a soft lens and doing all this other stuff, the dreaded bowl out is what I remember from residency, when you're trying to grab pieces and you're trying to crack, and then you just have this bowl out where you have this endonucleus that's essentially gone because, again, it's soft, but you have somewhat peripheral endonucleus as well as peripheral epinucleus. And what do you have to do? You're taught to go after the lens piece with a vacuum. Well, when you've done that and you've debulked the lens, now you're applying high vacuum towards the lens material, but guess what? You're close to the posterior capsule. So now you've created a difficult situation for no reason because you're applying high vacuum, which is potentially dangerous, and you're going closer to the posterior capsule. It absolutely makes no sense to do that. Why would you do that? And you basically lost that competitive advantage and protection because now you're applying this high vacuum closer to the posterior capsule. It makes no sense to do it that way. Yes, you can invest in a pre-chopper, but most of the time you don't really need that for soft lenses. Yes, you can invest in a MyLoop, but why would you do that on a soft lens? Normally you're supposed to use that for really dense lenses if you don't feel comfortable about fracturing really mature cataracts. So with the soft lens, again, some people go at it as if it's a denser lens. Of course, if you have a 2+ dense lens, that is really the ideal lens for divide and conquer, because it has enough density that when you sculpt and then you try to crack, you actually have some leverage to be able to crack and separate the fragments and the quadrants. But at the same time, it's not super dense so that when you're pushing down to sculpt the lens, you're not causing any zonular trauma. But not every case is going to be the perfect 2+ lens where you can divide and conquer. And so it's important for you to be able to not just disassemble certain types of lenses confidently, but employ a technique that can tackle basically any type of lens that comes your way. And so that's why I feel like mechanical fracturing, double chop, cross chop is really the best way to disassemble the lens. Because when you look at any technique, whether it's doing cataract surgery or whatever, you have to ask yourself, what gives you the best chance for success? So now you've seen that I removed the entire endonucleus. I'm going to start to remove the epinucleus from anterior to posterior. The epinucleus tumbles out and I have the chopper deep. I'm being careful when I'm applying the vacuum to make sure I don't go near the posterior capsule with it. Again, the chopper is deep to protect me. Judicious amounts of vacuum. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. There's a little bit of a reverse pupillary block, so I lift the iris. I start subincisionally removing and peeling off the cortex from anterior to posterior. Switch to polish mode, polishing underneath the rhexis edge. You can see the lens epithelial cells start to come off really nicely. You can see a very nice clean bag, again, in this very large pupil, which is just a beautiful anatomy to illustrate all the techniques that I just described. Polishing the posterior capsule as well, using a BSS cannula to pulse the subincisional capsule fornix, which was clean. Injecting some cohesive viscoelastic to fill the capsular bag. And this is a Singer sweep, the Singer Koch sweep. You can see as I sweep it, that subincisional lens epithelial cells start to come off real nicely. And it does have that sharp edge, so you're able to apply a nice scraping force to scrape the lens epithelial cells off. This is a single piece acrylic lens. It's going to go into the capsular bag. Go in with irrigation off, activate irrigation, making sure both haptics are off the optic, tilting the optic, going underneath the lens, rotating it 90 degrees, removing the viscoelastic from within the bag. Switching to polish mode, polishing underneath the rhexis edge some more, switching to visco mode, and then I'll hydrate my incision. So again, this is a giant pupil soft lens golden ring. Golden ring really allows you to place your chopper safely within the epi and endonuclear interface. There's absolutely no excuse or no worry about placing the chopper correctly. Again, you want to push down along the epinuclear ridge to make sure that you're going in the bag. I always like to lead with the tip. That's a thing that I do, and it gives me a lot of confidence that I'll never be over the capsular bag. And that's one thing I do recommend, is make sure you lead with the tip. And again, you're placing the chopper tip within the epi and endonuclear interface. You're not near the capsular bag. It's very safe. So, I use the example of, like, let's say martial arts techniques, right? So you can have a technique that's basic, it works great, but against a insurmountable opponent, you're going to lose, right? If you are a white belt and you're doing a white belt maneuver, you don't have enough experience, nor do you have enough moves within your repertoire to conquer your opponent. However, if you're a black belt, you not only have the skills of the white belt, you have the skills of all the other belts as well, and as well as this particular technique. So whenever you're encountering a really challenging opponent, you're not worried, you're not lacking confidence. If you see that the opponent is doing something towards you, you know what to do, and because you've seen it before and you know how to handle it. See, the problem with some of these techniques is you get stuck. You get in a situation and you get stuck. And getting stuck has to do with your technique. It has more to do with the technique and the way you've been taught. And so all I'm trying to do is open the eyes of folks. Look, this is adding another dimension of your surgical armamentarium in order to expand your repertoire. And so under certain situations, rather than being stuck, you know how to overcome it with mechanical fracturing forces, double chop, cross chop, hooking lens pieces up by getting the chopper out to the equator. So this is the reason why I'm so passionate about this technique, and this is why I think this is the best way to do cataract surgery. So I hope this was helpful to you, and I thank you for your attention.